Hello my beloved viewers, today I want to talk about cervical cancer. Just as it's mentioned, cervical cancer, this is a disease that affects only the cervix, but when this disease grows to high extents, it can also spread to other parts of the body. Let me say that cervical cancer is in two types. We have number one that we call the squamous cell carcinoma, and we have the adenocarcinomas. The squamous cell carcinoma accounts for about 80 to 90% of patients who present with cancer, and adenocarcinoma accounts to around 10 to 20% of patients who present with cancer. But may it be the squamous cell carcinoma or may it be the adenocarcinoma, the effects are the same and also the presentations are the same. But many people fails to realize they have cancer because the signs and symptoms of this disease takes very many years to show up. But this is a disease that actually you can detect in very early stages. That is when you undergo the usual screenings that are there. The signs and symptoms of this disease when they start to occur, many people can confuse them with other gynecological conditions, and one of the most common that will get when you have this disease, it's number one, you will have vaginal discharge that might be watery, or it can also be bloody. Number two, you will experience painful sex. This pain can happen maybe during sex or after intercourse or even on the process. And also another symptom that you are most likely to experience is whereby you have bleeding. You might experience bleeding in three categories. Number one, you might experience bleeding after you have your sexual intercourse. You notice you are bleeding, or you notice there's some spotting. Number two, you might experience bleeding in between your periods. Maybe you get your periods today, and even before you get your next period, you notice there is some bleeding that is not usually menses. And number three, you will also experience bleeding even after menopause. So these are where you will find people who are above 50 years and they are still experiencing vaginal bleeding. And some people, when it gets to this point, they tend to confuse themselves that maybe they are still menstruating, but that is not usually the case. Another sign is that you will experience painful urination, but when these symptoms persist, you are most likely to experience things like weight loss. You have severe back pains. You start experiencing very bad headaches and a feeling of you are not comfortably or okay. And allow me to say that one known cause of this cervical cancer that we refer to as the human papilloma virus, or the HPV. But let me remind you that every person in lifetime maybe has ever suffered this HPV, but it's only in rare cases that this HPV progresses to cause cervical cancer when there are associated risk factors that can predispose you to suffering from cervical cancer. And these risky factors that we are talking about here, it's maybe when someone is immunocompromised, maybe you have any condition that is making your immunity to go down, conditions like diabetes, conditions like HIV, or any other kind of immunocompromising condition. Another group of people who are at risk of developing this cervical cancer are the people who have multiple children. And the studies are also showing that the people who have been in prolonged use of birth control pills for several years, they also get into category of people who are likely to suffer from this cervical cancer. People who also have multiple sexual partners, because having multiple sexual partners continues to predispose you to suffering the human papilloma virus, because this one is a virus that it's only sexually transmitted. You can get it either maybe by anal sexual contact, by the vaginal sexual contact, or even the oral sexual contact. Another group of people that is more likely to suffer from HPV that will end up resorting to cervical cancer, it's people who indulge themselves into early sexual intercourse before they attain the age of 18 years and above. But even if this condition is there, or even if you suffer maybe from this HPV, it doesn't mean that any person who suffers HPV will end up getting cervical cancer, because we say it's only in a low percentage, and maybe when there is a presence of all these other predisposing factors that might lead you to suffer from this condition. And one way that we can prevent this condition, we have two types of vaccination. I am very sure majority of you have heard about the HPV vaccination. And in this HPV vaccination, we have two types. We have what we call quadrivalent HPV vaccine. And quadrivalent HPV vaccine, that one is responsible to protect you from HPV type 6, type 11, type 16, and type 18. And we have the second type of HPV vaccine that we refer to as bivalent HPV vaccine. When you get this vaccine, it will only prevent you from type 16 and type 18 of HPV. So with that, let me say that if cervical cancer is detected in early stages, it can be curable. But if you delay and we realize that you have this condition in later stages, then it can be hard for us to help you to completely cure this condition, and we can only put you in chemotherapy, radiation, and other supportive managements. And also allow me to say that cancer cells survives highly in high glucose levels, and that is why we advise any person who has cancer, we try to advise them to avoid anything that is sugary, like carbohydrates, any processed meals, and anything that contains glucose. So because if we deprive cells of glucose, then these cancer cells will start to shrink, and in higher percentage, these disease will not be able to knock you down. If you have any other question, you can just ask in the comment section, and until next video, I sign out.